Imagine a danger that whispers instead of shouts, a health crisis that often goes unnoticed until it's too late. For women over 70, this silent threat is a reality: the silent heart attack. It's a critical topic for every woman and her loved ones to understand, as early recognition can be life-saving. A silent heart attack, medically known as a silent myocardial infarction, SMI, occurs without the classic intense chest pain often depicted. Instead, its symptoms are subtle, easily mistaken for less serious conditions. This makes it particularly insidious, especially for older women. Unlike the dramatic chest-clutching pain, a silent heart attack might present with vague discomfort or unusual fatigue. It can damage the heart muscle just as severely as a loud heart attack. Recognizing these quiet signals is paramount for timely intervention. The term silent doesn't mean there are no symptoms at all. It means the symptoms are atypical, mild, or attributed to other causes. This often leads to delayed diagnosis and treatment, increasing the risk of future heart problems. Women, especially after menopause, experience heart attacks differently than men. Hormonal changes, particularly the decline in estrogen, play a significant role in altering symptom presentation. This makes traditional heart attack signs less reliable. As women age, they may also have coexisting health conditions like arthritis or diabetes. These conditions can mask or complicate the recognition of heart attack symptoms. It's easy to dismiss new aches or fatigue as simply getting older. Furthermore, older women might be less likely to report subtle symptoms, fearing they are being a burden or that their concerns will be dismissed. This self-silencing can have serious consequences for their heart health. It's crucial for women over 70 and their families to be aware of these often overlooked symptoms. They can be vague and easily attributed to other conditions, but vigilance is key. Pay close attention to any new or unusual feelings that persist. This is not always crushing pain. It might feel like mild pressure, squeezing, or fullness in the chest. It can come and go, making it easy to dismiss as indigestion or muscle strain. This discomfort might be centered in the chest or spread to other areas. It's a sensation that feels off rather than acutely painful. If you experience this, especially if it's new or unusual for you, do not ignore it. Even mild chest pressure warrants immediate attention. Unexplained breathlessness, even with minimal exertion, can be a significant warning sign. You might feel winded after activities that were previously easy, like walking across a room. This can also be accompanied by dizziness. This symptom can be particularly concerning if it occurs suddenly or worsens over time. It's often mistaken for asthma, anxiety, or simply being out of shape. However, it could indicate your heart isn't pumping blood efficiently. A sensation of near fainting, feeling unsteady, or general lightheadedness can occur. This happens due to reduced blood flow to the brain, a potential consequence of a struggling heart. It's more than just a momentary wobble. This symptom can be particularly alarming and should never be ignored. If you feel like you might pass out or experience persistent dizziness, seek medical help immediately. It's not just a sign of aging. Experiencing unexplained cold sweats without physical exertion or a fever is a red flag. This isn't just feeling a bit chilly, it's a sudden, clammy perspiration that can be quite unsettling. It often accompanies other subtle symptoms. These sweats are your body's stress response to the heart's distress. They are different from hot flashes or night sweats. If you find yourself suddenly clammy and cold, consider it a serious warning. Nausea or vomiting without an apparent digestive cause, like food poisoning, can be a symptom. This abdominal discomfort is often dismissed as indigestion or an upset stomach. However, it can be linked to heart issues. The vagus nerve, which connects the brain to the stomach, can be stimulated during a heart attack. This can lead to feelings of sickness. If you experience unexplained nausea, especially with other symptoms, be cautious. Overwhelming weakness or fatigue that goes beyond normal tiredness is a critical indicator. This isn't just feeling a bit sleepy. It's an extreme, debilitating exhaustion that can come on suddenly. It might make simple tasks feel impossible. This profound fatigue can be a sign that your heart is working harder to pump blood. It's often dismissed as a natural part of aging or stress. However, persistent, unusual fatigue should always be investigated. Discomfort can radiate to the jaw, neck, back, shoulders, or arms. This pain might be dull, aching, or a feeling of pressure rather than sharp. It can be easily mistaken for arthritis, muscle strain, or nerve pain. For women, back pain, especially between the shoulder blades, or jaw pain can be particularly common. Don't assume it's just a crick in the neck or an old injury flaring up. Consider the possibility of a heart issue. Some women may experience symptoms similar to the flu, such as body aches, general malaise, and fatigue. However, these symptoms won't be accompanied by a fever or typical respiratory issues like a cough or runny nose. This can be very misleading. If you feel unwell with flu-like symptoms but without the usual cold or flu signs, and especially if you have other subtle heart attack symptoms, it's important to consider your heart. Don't wait for it to pass. Silent heart attacks can sometimes be mistaken for indigestion or heartburn. The discomfort might be felt in the upper abdomen or chest, leading to self-treatment with antacids. However, if antacids don't help, or if the discomfort is unusual, it's a concern. If you experience new or worsening indigestion, especially if it's accompanied by other symptoms like shortness of breath or sweating, seek medical attention. It's better to be safe than to dismiss a serious cardiac event. Family members play an invaluable role in recognizing these subtle signs. They often notice changes in their loved one's behavior or energy levels before the individual does. Open communication is absolutely vital. Encourage your elderly female relatives to discuss any new or unusual symptoms, no matter how minor they seem. Create an environment where they feel comfortable sharing their concerns without fear of dismissal. If you observe changes like increased fatigue, unexplained breathlessness, or complaints of vague discomfort, gently but firmly encourage them to seek medical advice. Offer to accompany them to appointments. If you or a loved one experience any of these symptoms, especially a combination of them, do not hesitate. Time is muscle when it comes to heart attacks. Every minute counts in preserving heart function. Call emergency services immediately, e.g. 911 in the U.S. Do not try to drive yourself to the hospital. Paramedics can begin treatment on the way and are equipped to handle cardiac emergencies. Clearly describe the symptoms to the emergency operator and paramedics. Mention that you are concerned about a possible heart attack, even if the symptoms are subtle. This helps them prioritize your care. While silent heart attacks can be insidious, many risk factors are manageable. Regular checkups with your doctor are essential for monitoring blood pressure, cholesterol, and blood sugar levels. Adhere to prescribed medications diligently. Embrace a heart-healthy lifestyle. This includes a balanced diet rich in fruits, vegetables, and whole grains, and low in saturated fats and sodium. Regular, moderate physical activity, as advised by your doctor, is also crucial. Managing stress, maintaining a healthy weight, and avoiding smoking are also key components of heart health. These proactive steps can significantly reduce the risk of all types of heart attacks, including silent ones. It's a myth that heart attacks always involve dramatic chest pain. It's also a myth that older women are too old for aggressive treatment. Every heart deserves care, regardless of age. Empower yourself and your loved ones with knowledge. Understand that your body communicates in many ways, and sometimes its most urgent messages are whispered. Listen carefully to these whispers. By being informed, vigilant, and proactive, we can better protect the hearts of our beloved elderly women. Let's turn the silent threat into a loud call for action and care. Don't let the silent nature of these heart attacks catch you or your loved ones off guard. Share this vital information with every woman over 70 in your life and their families. Schedule a heart health checkup today, discuss any subtle symptoms with your doctor, and commit to a heart-healthy lifestyle. Your proactive steps can make all the difference in protecting precious hearts.